Miss Letterman is a healthy 32-year-old in her first trimester of pregnancy. She's working with a dietitian to determine if she needs to adjust her food intake to support a healthy pregnancy, especially considering that she is and has been a vegan for about half of her life. Currently, she consumes 2,237 calories per day, which includes 71 grams of protein, 15.2 grams of linoleic acid, 0.54 grams of alpha-linolenic acid, 2.1 micrograms of vitamin B12, 3 micrograms of vitamin D, and 15 milligrams of zinc. Her zinc and linoleic acid intake are in healthy ranges, though she could benefit from increasing some of the other values. Increasing overall intake during pregnancy is key to supporting healthy fetal development. The recommended energy intake for pregnant women includes a 340-calorie increase during the second trimester and a 452-calorie increase during the third trimester. Vitamin and mineral needs increase too. Ms. Letterman will want to increase her caloric intake in a few weeks when she reaches second trimester and will need to begin gaining weight more steadily to meet recommendations. Ms. Letterman consumes the exact amount of protein recommended for pregnant women, 71 grams per day. However, since she gets her protein from grains and legumes, it may not be as well absorbed as animal proteins. She may benefit from increasing her protein intake by about 30%. Protein is important to fetal development because it builds and maintains tissues and supports the increased blood volume of the mother. Ms. Letterman has low levels of vitamin D, B12, and alpha-linolenic acid. Her vitamin D intake falls way short of the recommended 15 micrograms per day. Vitamin D is critical for healthy bone development in the fetus, and it also promotes calcium absorption. It's not uncommon for vegans to be deficient in calcium, vitamin D, and B12, and this is reflected in her dietary analysis, as she's also just short of getting enough vitamin B12. The recommended daily intake for pregnant women for B12 is 2.6 micrograms per day, and this aids in preventing birth defects due to the relationship between vitamin D, B12, and folate. Ms. Letterman also doesn't consume sufficient amounts of alpha-linolenic acid, which should be around 1.4 grams per day. EPA and DHA are two of the essential alpha-linolenic acids, and each play a critical role in supporting a healthy pregnancy. EPA reduces inflammation, dilates blood vessels, and reduces blood clotting. DHA is a major structural component that supports the central nervous system. Women who consume enough of these nutrients during pregnancy tend to have infants that are more intelligent, have better vision, and have more mature central nervous system functioning. The mother may also have a reduced risk of preterm delivery. If Ms. Letterman chooses to stick to her vegan diet, she can obtain vitamin D from fortified orange juice, fortified cereals, or fortified alternative milks like soy milk. Fortified products can also be a good source of vitamin B12 for vegans. DHA is available in some fortified snack foods, but the richest source is fish and seafood. She can also obtain alpha-linolenic acid from flax seeds, walnuts, and leafy green vegetables. However, if Ms. Letterman is open to switching to a pescatarian diet during her pregnancy, she might choose low-mercury fish like salmon or catfish to obtain more EPA. Overall, Ms. Letterman is eating well to support her pregnancy. With a few adjustments, she should have optimal intakes to support her child's growth and development.